Have you noticed bunch of hair on your pillow or your dress or on the floor while you're taking shower? Hello, I'm Dr. Mitra. If you or one of your family members or friends is experiencing hair fall recently, and if you want to have an overview of this issue, please be with me in this video, in which I discuss common causes of hair fall and their potential treatments. First, I go through a brief introduction to the cycle of hair growth. First is growth phase or active phase, in which new hair is formed and the cells divide rapidly. The second phase is called catagen phase, in which the blood supply to cells is cut and so no new hair is produced anymore. The active phase might take 3 to 5 years depending on the ethnicity. And the third phase is called Telogen phase, in which hair strands do not grow actively anymore. And Telogen effluvium, one of the most common causes of hair loss, happens when your hair is in the stage of telogen. But how does Telogen effluvium look like? And how is the presentation? You can notice the shedding of your hair. Depending on the reason of Telogen effluvium, the treatment is also different. One of the treatment strategies in Telogen effluvium is mesotherapy, which multiple injections are employed on the scalp. The injection increases blood circulation, and they also contain nutrients and vitamins that help hair growth. Another treatment strategy introduced for the management of hair fall is injection of Botox, the famous Botox which many people use for the wrinkles of their face. Yes, it can also be effective in management of hair fall. And the mechanism is maybe to relax the muscles and so improves the blood circulation, and then in this way it improves hair growth. In a recent clinical trial, mesotherapy injection and Botox injection treatments were compared between two female groups who were suffering from hair fall in their 20s and 30s, and then the result was evaluated. The result of this comparative study showed that both treatment strategies had good efficacy with minimal side effects. But Botox therapy had the advantage of just one session of therapy rather than multiple sessions of therapy in mesotherapy treatment strategy. But keep in mind that before choosing any treatment strategies, first you should consult with your doctor in order to exclude any underlying results like anemia or hypothyroidism or other problems that might be cured by medication or maybe some more simple strategies. And the most common cause of hair loss is called hereditary hair loss, which occurs in both men and women. The presentation in a man is usually a receding hairline with bald spot at the top of his head, and for the woman the pattern is the overall thinning or the widening part in the scalp. Another name for this type of hair loss is also androgenetic hair loss, regardless of the gender who is affected. Androgens, at the beginning of this name, are sex hormones which give men their male characteristics. Testosterone and dihydrotestosterone are two androgens, and testosterone is converted to dihydrotestosterone through an enzyme. One of the treatments which is approved by FDA is finasteride. They are used in tablets and it is just for use in men that prevents from the conversion of testosterone and dihydrotestosterone. Keep in mind that it is not approved for use in women for androgenetic hair loss, and so women must be very careful. And of course, this is more important for pregnant women, which even touching the tablets might have bad effects on their fetus. Another standard treatment, also approved by FDA for this type of hair loss, is minoxidil, which is usually used topical. This treatment is also approved for women use. The two treatments I mentioned were FDA approved. Another treatment used for androgenetic hair loss is platelet-rich plasma therapy, or PRP. In this method, plasma is taken from blood of the patient and is injected into their scalp for a stimulation of hair growth. In one study, it was shown that doing PRP therapy once a month for 3 months is effective for treatment of androgenetic hair loss. And also there was a review study indicating that this treatment doesn't have serious side effects and it can be effective in different populations. But other clinical trials and studies are needed to take into account the variabilities among different groups. in order to optimize a treatment protocol for this strategy. Correction alopecia, another type of hair loss. A preventable cause of hair loss is related with your hair care, and maybe you know it with ponytail hairstyle, those who pull back their hair very tightly. And this hairstyle, when it is frequently used, may lead to hair loss, and unfortunately it would be permanent. So be careful about your hairstyle and be more gentle while you are pulling your hair. Another type of hair loss, which is related again to your hair care, is dyeing your hair. I know that many women and young girls are very enthusiastic about dyeing their hair on a regular basis, but in this way you just expose your hair to chemicals that might hurt your hair and lead to hair loss. So be careful. If you want to dye your hair, try to use more natural products, okay? I hope that this brief introduction to most common causes of hair loss and the preventable ones have been useful for you. Please like, comment, and subscribe my channel for more videos like this.